Hey guys, real Dr. Jin here. Very glad to welcome you back. And I hope you have a very good Thanksgiving. I had too. And I had so many patients. What kind of patient? COVID patient. With the, with the Thanksgiving, a lot of patients now come to the testing. A lot of patients get positive, a lot of patients get exposed, and more patients get exposed. So we have tons of patients come to the clinic recently. And today, I tested about 50 patients. And what's the positive rate? You may ask this question. So it's about 10% to 20%. That means real Dr. Jin saw 10 COVID patients today, likely. Yeah, and that is very sad, and I heard a lot of stories from this COVID patient. Their family situation is different, and this posed them a very difficult situation. And I try to help them more. I try to spend more time with them to tell them what to do. But as you know, in urgent care, our time is very limited. We can't help them every detail. But today I have a good idea. I'm going to invite a COVID patient, and then we can do this talk show, and I will address all the questions and we'll discuss. And another thing I need to mention is today I invite two guests. You may only see one, right? Actually, I invite two. One is patient Jane, another one is Dr. Jane. Okay, so let's welcome patient Jane and Dr. Jane.
Thank you so much, Dr. Jin. It's a great opportunity to learn from Dr. Jin. This is Jane. I have an interest in healthy living, and I'm also a healthcare provider in Midwest. Unfortunately, about 2 weeks ago, by now 2.5 weeks ago, I contracted COVID-19, and as a healthcare provider, I was able to track my symptoms and management and outcome. So I would like to share that with you because I feel especially in our community, being empowered with medical literacy and know where to look up the most up-to-date, accurate information facing a terrible illness is very important. So I appreciate this opportunity.
Yeah, so first, I'm so glad that you come back to yourself totally, 100%, right? I remember last time we talked, you still have some lingering coughing. How about that?
Yeah, I think by now I'm 2.5 weeks out. I had my diagnosis on November 24th. I would say I have to say reality is 80%.
Okay.
What hasn't recovered is I have a lingering cough, especially when I speak a lot. It's not exacerbated by exercise or other things, but it really limits my, have some quality of life impact because I have to see patients and talk a lot. So I'm actually still on a prednisone taper where what is prescribed by pulmonologist. It's not new. Every time I get a flu, cold, I tend to get this type of exacerbation. But even that is better. So I think for me, respiratorily, just this lingering cough, reactive airway disease related. Fatigue, maybe a little bit. I'm not quite my 100% doing 10 things. I'm maybe doing 8.
Okay. Yeah, and here are the flowers for you, okay? So
Wow, thank you.
to come back to 100% soon,
Yep,
all right?
I hope so.
Yeah, you can. Can you give us some stories like how it happened, how it happened to you?
Yeah, I think it's very helpful that I kind of record it on a daily basis and share that with my circle of friends and the community. So what happened was prior to my symptom onset, I was on inpatient service week, which is particularly more a little bit more stressful on a regular work days. And I think that speaks strongly for healthcare provider self-care and how to manage stress, anxiety. Working in a hospital these days, just like Dr. Jean mentioned, there's a lot of very seriously ill COVID patient, and we want to spend more time talking to the patients, talking to the family member, sometimes talking through the face mask, face shield is very difficult. So I intend to get a little closer with the patient. Many of those patients are not able to wear face mask or any type of self-covering, face covering measure. So I think there's multiple factors. I would say probably more likely at work, because at home, my husband that week does all the grocery. My two kids are all high school, learning from home, and they're all fine. We have no visitors. We were really busy and also intended to stay home. So my symptoms are fever. I had so-called low grade 100.6, but this was terrible for me. I haven't had fever for years being an adult. I had diarrhea, a lot of loose stool that got me dehydrated. Fever, chills, body ache, cough, and then diarrhea, and abdominal upset and not having any appetite, very tired. I think that all came on probably over just one day. I had to say the week before I had a little bit of fatigue, but I attributed that to just being on service, having more work to take care of. Looking back, I think some of the neurological toxicity like sleep disorder is a very prominent feature for me. I didn't have the loss of smell, loss of sense, or dizziness, vision, or even memory or COVID brain, none of that. But I had trouble getting into deep sleep. I'm relatively I'm relatively athlete, so I wear a Fitbit, so it tracks my baseline heart rate and my heart rate when I exercise and my sleep. So from the week before, and definitely in the 2 weeks I was acutely ill, the deep sleep shortened from an hour to an hour and a half to barely like 30 minutes. Earlier, I thought that would be fever, but really that wasn't true after 72 hours. Maybe that's just my observation. I looked up the data, but I have to say I didn't see anyone reporting the sleep disturbance. Oh, there is a neurologist actually report that you just couldn't go into sleep. I wasn't like that. I can sleep, but just mostly in not in the deep sleep. So the first 72 hours is very tenuous. I was hypotensive. My blood pressure was 82/60. At one time point that I was still trying to work, doing remote telemedicine, but that became quickly obvious that was not feasible. So I was able to work with my team and then come off work. That was the second day of my diagnosis. At that time, it still take 24 hours to get a diagnosis from nasal swab. So I was sick on Tuesday, but have to wait until Wednesday to know I was confirmed positive. That time, I think the cough, my pulse ox has always been greater than 96, but my baseline is 98 or so or above. I don't know if there's any biological measures. But after 72 hours, I think 72 hours is really critical. After that, you feel markedly better. You feel like the fever subside and you can eat. Diarrhea becomes more of increased stool frequency rather than pure liquid stool. But really it takes about 7 to 10 days to feel about ready to go back to work. So I did work throughout the 2 weeks, but I had days off because Thanksgiving, and I had some scheduled time off. But I'm completely back to normal schedule from last week, Wednesday. It works out. I still have to remind myself not to work out as much as I used to do, but I'm able to keep up with activities at work in different setting, and my charting, everything is up to date. So I think I'm back to normal, but just if you have a goal of train for a marathon, you might have to delay that. But I think my training goals have to be reset to be much more modest. Overall, I think it is not a flu at all. It is, I had flu 2 years ago, despite a flu shot. I had it towards the end of the season. I bounced back within a day. I had a high fever, 102. I even took antiviral therapy for Tamiflu for influenza. So I bounced right back, and I was able to back to work. I had the residual reactive airway disease for a couple months, but nothing like hypotension, diarrhea, feeling tired. The extreme fatigue is really very hard to explain if you have not experienced it. I described that when I tried to put on my makeup, my hands were shaking. It was remarkable. But luckily, I think I was all the effort I did before, exercising, eating well, have good social support, have a good health support, like my doctor be in touch with me on a daily basis for the first week. All that paid off. I'm still very happy, very grateful for the recovery I had.
Right. So like you mentioned, the flu, right? Last year, I saw so many patients in the clinic because I'm working in the urgent care, so many flu patients. And this year, most of the patients came for the cold symptoms. The diagnosis is totally different. Mainly, it's like some common cold, or it could be the COVID. Up to now, I only see 1 or 2 cases of flu. So, and I think that's a like good benefit this year. We have less flu, or the flu will be delayed like very much. And another thing, like for this comparison for the flu and the COVID, there's one huge difference is the loss of smell and the taste. Yeah, I also did a video for this, we called dysgeusia. If anybody interested about this dysgeusia, you can check my previous episode. And I do see a lot of patients came, if their only complaining is loss of smell or loss of taste, and they should be suddenly, then the diagnosis always COVID. Yeah.
So specific now.
Yeah, and I think that kind of like the specificity, maybe I don't have the data close to some rapid testing can be,
Do you still test the flu, influenza A, B at point of care, right? You do a swab or no?
So usually if patient have some fever, cough, and some fatigue, we do together. We will do this rapid testing and flu testing at the same time. And last Monday, we do have the first case have 2 positive. It's flu A and the COVID.
Okay, concomitant infection of both.
Right. So the flu is on the way, but I hope that it's just miss the train, for the winter, for this winter.
Right.
Yeah.
Right.
Bye. Yeah. So also I have some other questions for you, and so what do you think is your major symptoms for this infection?
I think it's the fever, the cough, the fatigue, diarrhea, GI symptoms. I had the constellation of all of that. And by the way, because I had some prior illness with my prior lung disease, so I had a CT scan around day 11. I waited that long because I wasn't having an indication. I had that CT more for a new baseline for my future follow-up. And I the imaging did show right lower lung infiltrate, ground glass opacity, which is consistent with the atypical pneumonia. Although it's not the typical atypical because I didn't have bilateral involvement. My pulmonologist also comments that that's not very common, but maybe that's the vulnerability, maybe it has something else, but the timing, the symptom onset, that really argues, and my recovery.
Right.
I'm going to have a repeat x-ray beginning of the year, but I think for me I was respiratory, febrile, typical viral illness symptoms, body ache, and GI. I was lucky not having a lot of neuro other than the sleep. I didn't have any cardiac, I didn't have any blood clot, bleeding, rash, I didn't have any of those. Yeah.
That's good. Sounds like you have a lot of GI symptoms. As I know, like when patients have some GI symptoms, one of them is loss of the appetite. And in that situation, our body needs a lot of protein to produce the antibody and to fight this virus.
Right.
But loss of appetite, you can easily be like malnutrition. And when you have the diarrhea, and you may have some dehydration later. So how do you handle that situation?
Right. I think that argues being the readiness, where in the pandemic, that's the purpose of Dr. Jin and I would like to make sure everyone is prepared for those you never think is going to happen. So in terms of monitoring, I really made sure I had a pulse ox with pulse and oxygen pulse oximeter, so you can measure your O2 set. That's very critical. If anything drop below 90, you really have to call ER. You have to go to ER or get 911 to go. So I was above 96. That was fine. So pulse ox is one thing. Blood pressure cuff I had, and the thermometer, and know how to use it. I actually had one to put under the tongue, but I'm Chinese, so my mom put under my arm. So I was slow, I just did that. So that's not following the manufacturer protocol. So that may not be reliable, but when you have a real fever, that may be okay. So really have those three things ready to use so you can monitor yourself. And then have those emergency medication ready. I wasn't. So I have to say that's a lesson I learned. The Gatorade or Pedialyte, those the component of sodium, glucose, and of course water make it readily to be absorbed by GI tract. So you can absorb the glucose and the electrolyte, sodium, potassium readily. So my husband was able to rush to the drugstore and get those for me on the day that I had a lot of diarrhea, dehydration. So I didn't need any IV fluid. I bounced back fairly quickly. So those oral electrolytes, when you don't have anything, you can get some salt into your water or add some sugar. Whatever you can do, maintain your blood pressure is critical. But of course, if you have any comorbidity or blood pressure is not bouncing back up, if you are feeling not able to just start to feel very distant and sweating a lot, you really have to call 911. And the other thing is nutrition. So I did drink Ensure because the calorie and the protein for the first 1 or 2 days. But for me, I think the problem is suppress your natural appetite. So in those days, maybe it is some type of loss, sense or taste changing, because I felt like it was in my first trimester. I had 2 pregnancy, very miserable. I just I can only eat what I love. All those traditional food, how I was brought up, I'm embracing. But anything like gas station smell or something that is wrong, it's maybe female's natural protection. And for the first 3 days, I felt like I went back to my first trimester. Maybe that's also some manifestation. So I really got a lot of community support. My neighbors, they helped me make my I'm from Beijing, so a lot of Beijing traditional food made and brought to our house. That helped me tremendously. So I think in those days, you really, you can forget about your weight loss menu, just do whatever it takes to get fluid and get nutrition, calorie.
Right. Like you said, the nutrition is very, very important. during the recovery. I think another thing important in the recovery is the sleep. As you mentioned, you have also developed some sleeping problem, right? So if you not sleep well, maybe the recovery will be like delayed or like can give you more like complications. So when your sleep is disturbed, like do you have some good ways to show us like how you improve that?
Okay, I can share with you what I tried, what I think could help, and
Okay.
everyone is different. What I really liked is meditation. You know, I did try medication. I took melatonin. Melatonin is over the counter. It's a supplement. You can pick, most common is like 3 milligram or 5 milligram. I used to take 1 milligram on a regular basis because a little bit of anxiety or getting too excited before bedtime, reading all the news. It's my long-term problem. I think I need to modify that. So I do try the melatonin. I know I have no side effects, so I tried that. Someone may want to think about Benadryl. I'm not recommending, and I even didn't use that myself because I tried it once. It makes me very groggy. So medication-wise, I really just tried melatonin. It's hard to say. Maybe some help. I don't know. But I think meditation really helped me. Meditation is a way of there's some medical evidence supporting use body and mindness um, to help with anxiety and modulate your mood. That helps me because sometimes at night, you know, those 2 weeks I'm totally alone, could not be cannot be in proximity with my family. And even that part aspect is tough. So I do meditate. There are very beautiful words, very powerful, strong, but also peaceful paragraph. And that really, the music is helping. So at night, I use that to put me to sleep. And during the day, I take naps. And if I'm very uncomfortable, you know, just miserable, I try to sleep, turn off the TV, music, or I mean, don't spend too much time on social media because that kind of distract you. You need a lot of sleep. So I think for me, meditation helped a great deal, and getting a lot of support from my friends that comfort me, that help me to relieve my anxiety and a sense of hopeless. There's a time that you feel this is just so unfair. Why I get it? You know, there are always some mental aspect to it. And then some medication over the counter or under your physician direction. I think that's all to be considered. But for me, I just tried melatonin.
Mm. So like you mentioned, meditation really helps, right? You may need to stop searching too much information.
Mm-hmm.
Sometimes like too much information may overwhelm you. It's like when patients looking for something, the internet always tell us the sickest, the worst scenario. So in this situation, you're already very stressed out. And when you see this information, sometimes I don't know how you can like be like relieved the situation, you know.
Right.
And I do like agree with you, like melatonin may be a good choice if you have some difficulty sleeping, which can improve your situation. Yeah, apart from this melatonin, do you take some other medications? As you know, we saw a lot of medications like recommended by different specialists. What's your experience?
Okay. In terms of therapeutic or supportive care, I did go through at that time, the most current recommendation from CDC and from my own healthcare provider, because I was a milder case. So I have no indication to be in a hospital or receiving more specific treatment. But just to remind everyone since then, there's approval of the neutralizing antibody. There were 2 of them. And that do argue that if someone has symptoms, to be tested early and then to be evaluated for indication. That's very important. But at that time for me, there wasn't any specific treatment. It's pretty much supportive care. So other than symptom driven, like I did take Tylenol on the first 3 days, I pretty much took twice a day, one for headache, body ache, and for fever. The Imodium I used for diarrhea. Really just in the first 3 days because I tend to get constipation so quickly. I just lay that off. the Imodium, basically symptom fever, pain, GI symptoms, and the sleep problem, cough. I tried the Mucinex, but those are like horse pills. They're huge. So
Yeah.
I used a lot of the cough drops. That helps you, help me. Again, that is really, I actually don't think there's a lot of difference between one or another. Whatever give you some comfort, but cough drops help me a lot. Even now, I use them. And other supportive care medication. That's pretty much the supportive care. In terms of supplement, I did look up the internet, CDC. I think they mentioned about vitamin C. So I took vitamin C for 2 weeks, which I already stopped. The CDC stance is they do not recommend, but they do not recommend against either. There's also vitamin D. That I do believe, because especially I'm in northern states. In the winter, I particularly often get vitamin D deficient. So I'm already on a high dose weekly vitamin D. So my point is, if I wasn't, I'm going to take extra. Since I'm already on, I didn't. But I do believe vitamin D is vital in many aspects of health, and because of the indoor time that we had, vitamin D deficiency is quite common. So vitamin C, vitamin D, I did take zinc as well, but I just took for 10 days, even though there are some theory about its support for the immune system. But my belief is there are side effects like impaired copper absorption, causing copper deficiency and the cytopenias. So I stopped that fairly quickly, because I think when I can eat everything, I can acquire all that through my food. The other thing is aspirin, baby aspirin. I did take that for about 10 days because I was concerned about the risk of having a blood clot, especially first 3 days. I was pretty much just in bed or sitting. But that really need to be individual decision, and then discuss with your healthcare provider. I think that's at the point I may have tried probiotics, because there's some theory that this can alter your bowel bacterial flora, so restore normal bowel flora. I tried a couple days, but I'm really not a pill person. So looking back, I think really other than symptom support, I personally, my own experience, really don't strongly support any particular supplement.
But I know, like, when you get this COVID infection, sometimes a lot of symptoms like hit you at the same time. And if the symptoms like continues, and that may stress you out. So if you do have some symptoms, I believe if you take some over-counter medication, that do help, not only for this symptom, but also help your anxiety as well.
Right.
Yeah, and for this over-counter medication, different patients like have different experience. And some patients may feel, oh, this coughing syrup is helping more. And some people say, oh, that one help more, you know? So what you need to do is find like the best one for yourself.
Right.
For this over-counter medication, and the appropriate one is the best one for you, right?
Mm-hmm.
Yeah, and I heard like you say your husband helped you run to the like grocery store to get a lot of things. That means your husband so far is okay, right? Because isolation is a big issue for a lot of families nowadays. I also in the clinic I saw a lot of people when I deliver this bad news to them, their most worry is, oh, how can I do in my family? I have a senior in the family, I have kids in the family, and I do not like have a basement to isolate, and I live in an apartment. So many things. I don't know what's your situation, how you handle this isolation at home.
Right. I think because in the healthcare providing system, I kind of already knew what I'm going to do. Even like a dry run that earlier in the spring, because I thought I was going to hit by this pretty early. So for us, we're lucky that I had a master bedroom and I had the office, which are connected, are kind of separate from the rest of the house. Even in the week that I work heavily, closely with hospital service, I already isolated myself. We were not in the um, uh, same area. We still kind of, he helped me with my um, dinner time. We still spend some time not wearing mask. It was not an absolute isolation until I was formally symptomatic. So I put myself in very strict isolation that when I step off the room to go to the other room, I wear a KN95 at home. And my husband, if he really, I try not to get him to see me. There's a little table that he'll put water or food on that table. I'll pick up and medication if anything. If he really need to enter, he'll wear KN95 as well. But I probably should have him wear a face shield or something, but I I didn't do that, and I even for the first few days wear a glove if I have to pick up something, and have a different utensil from the rest of the family. I think we are fortunate to be able to do that, but I think to the minimum. If you have to be a closer distance with your loved one that infected, wearing mask, both of you is very important.
Right. And as you mentioned earlier, like you said, before this COVID infection, you do some exercise, that can really help you in this like situation to fight the virus, right? So do you learn some other like experience from this COVID infection? Like what kind of lesson, you may do more after this infection, what you may do less, anything like that?
I think in general, anyone who's in good performance status, have good
Uh-huh.
cardiopulmonary reserve, bounce back quicker and have less residual impact. So that I don't have a specific, but we all know the comorbidity, age, and obesity. I think I keep my BMI less than 25. I'm probably 21, 22. So really keep our weight within the healthy range and not even close to the 25 for female Chinese. We actually need to use 23.5 rather than 25, and also be aware of something called normal weight obesity, because even your weight is normal, but you have fat around your belly, that your waistline is big, that also is have some similar cardiovascular or other health implication. So I think all of that are good things I've done, but there's no hard data. But while I was sick, I did have time to look into, oh, when should I start to even move? When should I start to go back to exercise? There was an article that I found from a Chinese organization. They conducted research on how to assess patient recovered from COVID. How to measure their ability to participate in therapy and what type of therapy to do. I think that helped me. They have something like breath hold. See if you can hold your breath for 30 seconds. That's an indication. That's a passing score. And if you can do squatting, because squatting requires a lot of the major core muscle in the legs, and see if excuse me, that's the cough I'm still having. So if you walk for a minute, if your O2 sat drop or if your heart rate skyrocketing, so those are good things, because I think especially in our Chinese community, oh, after you're sick, you should bed rest. I think that I personally, for my instance, I don't think that's right because that increases your risk for anaphylaxis, infection, or muscle weakening, or blood clot. So to me, I make sure as long as I can be sitting, I don't just sleep in the bed. As long as I can start to move around, I even just listen to some music and pace in my master bedroom. So I try to maintain physical activity. I think that needs, everyone has their difference. People like me who really loves medical literature, you can learn yourself. There are probably support group. But if you are the ones need help, can think about some physical therapy evaluation formally. I still put a lot of emphasis on start exercise, rebuilding your routine early. I felt even going back to work, my routine build up again. So it's your body kind of know when they need to eat, when they need to digest, when they need to go to sleep. I felt a lot better after going back to work.
That's right. For the audience who don't know Dr. Jean before, she has YouTube channel and she has some very good YouTube channel to help you like lose weight, to be healthy. She has been doing that for a long time. You can check her video and then you can follow and you can, prepare, when you have a good health, maybe you can recover faster, right?
Thank you.
And
I believe so.
yeah. And the last part, since we are two doctors here, I think we can do some like debunk of this myth on the internet, because still some people like confused because of the internet. If there's no like doctor like officially tell them it is wrong, they may believe it because they can see that everywhere in the internet. Okay, so let's see what the myths on the internet. Number one is somebody say wearing a mask does not do anything. So what do you think?
Yeah, I definitely is a big advocate for wearing masks because there's data speaking for if, especially if the impact, like me, when I'm wearing mask 100% and absolutely follow instruction, cover your nose, cover your mouth, not to pull it up and down. Because by wearing the mask for the person who had illness, I believe it's 90% protection for the other end. On the other hand, if we as the healthcare provider wearing a mask, but the patient don't, we only get protected, I believe, 70%. But the best case scenario is we both ends wearing a mask appropriately. It can be more than 95% effective. So I think there's literature, there's places that they enforce the mask wearing and get good results. And even for us during the peak and the valley, we see the importance of wearing masks, even different states. I think for the benefit of ourselves, myself and community and my patients, I strongly recommend everyone wear a mask when you are with non-household members.
Yeah, that's also we do in the urgent care from the beginning. If the doctor and the patient both wear the mask, the risk is very minimal. If you can keep a little bit distance too, then it can make it even lower. And I noticed also recently the CDC, even they recommend this mask wear, and they say wear the mask can protect the wearer now. Initially they don't admit that, but now they say it can protect you if you wear the mask. Okay, please wear the mask.
Right, because the amount of the virus that that they can colonize or can infect would be less, and that reduce the severity of the illness.
Yeah. So another interesting mask that they call wearing a mask is dangerous because you will get carbon dioxide poisoning. What do you think?
I think it's not completely unfounded. There are some rudimentary experiment online showing that, but my perspective is always risk and benefit and alternative. To me, I think when we see confirmed or COVID-19 rule out, we have to wear N95, which is highly protective, but of course has less ventilation, higher CO2 retention. But for me, I have no chronic lung disease. I have no risk of CO2 retention, and I can always try to structure a break time so I can breathe freely. So to me, I think, and for probably most of the majority of the population, that is more a theoretical concern. The real concern is contracting COVID and having a serious complication from that. That's my personal perspective.
Yeah, that's the biggest concern, to contract the virus, not the CO2 like poisoning, right? I do see someone also do some experiment. When they wear the mask, they check the oxygenation, and without mask, they checked again. It's like very similar, you know, it will not give you any trouble wearing the mask if you do not have any like very severe condition. Yeah, the third one, they say all schools should be reopened because kids can't get COVID-19.
No, I think the last statement is apparently wrong because we do have pediatric population reporting COVID-19. Like my two kids, they're in boarding school, so they have to, so far the school is closed, all online. It's individual decision when it comes to every family, every kids. But I don't think it's right to say COVID is not in the pediatric, the kids or young adolescents. So that I don't believe, and I think we really need to protect our kids as well.
That's true. And you do in earlier, I write something on my like WeChat blog, and there are some reports like kids they die from this COVID infection, like in Florida. So this is real. You know, we need to protect our kids. We need to know like kids also can get infected, although the chance is maybe less than the seniors, right? And the next one is asymptomatic people aren't contagious.
Yeah, I think that's a terrible myth because multiple literature has shown the course is when someone get on zero contracting the COVID, it takes a couple of days for the viral to proliferate, and for about day 3 that can be tested by PCR technology, and then about day 4 or 5 they become contagious. Some of them become symptomatic around day 6. Day 5 or day 6, but some of them remain asymptomatic, but they are equally, or some of the asymptomatic person could be more contagious. And that's how some of the super spreading event and super spreader happen. And that is very dangerous because they may be doing things without their masking and in proximity with other individual. Those are really a myth that we need to make sure everyone aware that's a myth, that's not true. And that's why you have to assume everyone, not your household, is infected and protect yourself adequately. Absolutely, for asymptomatic carrier can spreading the virus can even be a super spreader.
Right. Even on some CDC guideline now, they even say maybe more than half like COVID infection patients come from this asymptomatic like people, you know, because they don't care much because they don't have symptoms. That's the way they spread the virus. And next one is young, healthy people won't die from COVID-19. I think this we mentioned before, even kids can like that, right?
Yeah, I think their death rate reported, they are, of course, increasing with age and comorbidity, but young, even myself, I was sick for 10 days. I was literally down for 72 hours. I could never, in my adulthood, I've never been out for so long, other than pregnancy. I'm probably in the hospital overnight. But this is no joke. This is very serious stuff.
Right. And next, they say you cannot get COVID-19 twice.
Yeah, I think reinfection has been confirmed. So I don't think it's true you can be totally immune. And natural immunity, how strong that is, that's really being studied. But to me, using this opportunity, speaking for my own analyzing of the natural history, the data, and the vaccination benefit, I can share with you, Dr. Jean, that
Mhm,
I'm planning to get the COVID-19 vaccination,
mhm.
hopefully in the next few weeks, even though I was recently diagnosed and is considered a recovered COVID-19 patient, because the data speaks for the natural immunity is about 1/4 of the vaccinated generated immunity. And because of my risk, I comparing the risk and the benefit and my own allergy history or risk for potential side effects, I personally still definitely decide to still receive the vaccination.
Right. And for me personally, I do see some patients like infected twice in my clinic. So this is real.
Mhm.
And for the problem, like you mentioned, if people get infected before, do they need to get the vaccine? When they should get the vaccine and how? I think this is a big topic. Maybe we will come back later when we have some more data for this. Still now it's a little bit debatable. There's no clear guideline yet, right?
Yeah, I totally agree. I think we learned a lesson from this pandemic that you will be empowered when the knowledge comes. So don't try to make decision like 3 months down the road or months down the road or 3 weeks later. So for those you may not be eligible at this time, now the decision I have to make because I'm a frontline healthcare provider, I need to make decision to sign up, and I'm trying to schedule that on a Friday afternoon, so in case I have some reaction, I have weekend to rest. So those I need to put on my planner. But for those, if especially if you are young, still do your masking, social distancing, avoiding aggregation, doing all those basics. You don't have to. You don't have to really worry about those reports because by the time you are eligible, there will be more reports, there will be more experience. We'll be our testers to give you the data.
Right, right, right. And next one, people mention you won't get the virus if you hold your breath when someone sneezes or cough.
Okay, I think that's really good that we can empower everyone by knowledge, because how the virus transmitting is the virus can get into your airway, even though if you don't breathe, it's like the air are disseminating. Sometimes you can still smell something even you don't inhale, and also even if you don't inhale down that too long, the mucous membrane, the receptor, the virus attach to that, and then they start to get into the cell and they start to proliferate. That's why we argue people wearing glasses have a 13-fold reduction in their risk. That was one of the data reported in China because the corneal has similar receptor as our airway. So that's the argument for wearing eye protection glass. So really, after you understand the virus are just floating there, they will attach to the mucous membrane cell, even you don't inhale, even you cover your mouth, that they can still get through, they're very small. I think really do the right thing, wear a mask, put on a face shield if you feel you're in a high risk region, 2 meters, 6 feet apart, and avoid trying to, in this time, today is December 12th. I really think we should avoid any contact with non-household member if possible.
Mm, right.
That's
So
my own practice.
is the key, right? Wear the mask. Don't use this like skills. This is not helpful at all.
Right.
And next one is consuming disinfectants will kill the virus.
Well, I never even thought about that. I think that's totally different, different thinking. This is a respiratory virus. It's not a GI tract, and don't do things that's not following the manufacturer instruction. That's very dangerous.
I believe this disinfectant do kill the virus, but if you like ingest it or consume it, that will kill you too,
Yeah.
at the same time. And next one is 5G technology spreading COVID-19.
That I don't know where you heard.
Now we're doing this internet, right? You may spread the virus to me. That's not true, right?
I think virtual wouldn't be.
Not at all.
I'll be open-minded to new information or new technology.
So the last myth we're going to debug today is the media is blowing this pandemic out of proportion,
I think because I'm a scientist, I tend to not make subjective comments. I'm very data driven. A lot of things, good or great, better or worse. It's really in the eyes of risk and benefit and alternative. To myself, it's very, very dangerous. There's no better way to emphasize the danger of it, because in fact, despite of I think I'm very up to date with all the protection measures and being very, very careful, but maybe some individual vulnerability, I still contract the disease. And I really want everyone who's at risk be extremely careful. About the media, it's very hard to comment, but from my own perspective, from my loved ones, my own people that I care for in my community, I really strongly believe this is a real threat.
Right. I believe, nowadays we do have this high technology like John Hopkins data or some other like database. They are like independent and they show like similar numbers. And this like 16 million infected people in the US, I think it's real. And also 300,000 deaths is also real. And they are not only the numbers, right? They could be your grandpa, grandma, could be your daddy, mommy, could be your friend, could be your colleague, and could be your neighbors, they are the real life,
Right. Do go to the source of the data yourself, and so that you are empowered by the real fact.
Right, we do need to take our action as much as we can. You protect yourself, protect your family, and that's the way you protect the society as well.
Yeah.
Right? And last thing I want to share you with one interesting situation which I come across in the clinic today. There's a 50-year-old male king, and he wants to get tested, but he's asymptomatic. I asked, oh, why you want to get tested? He said, oh, all my family members is like infected and they get isolated. I just want to know if I'm positive. If I'm positive, then I can join them. On this perspective, it seems the other family member is doing fine, but the healthy people, the patient is isolated at home. The healthy one, because he feels lonely, right? But most of the situation, when you get infected, a lot of people feel lonely. And if that's the situation, and if you happen to know Chinese, you can go to Dr. Jin's channel, and she's a best friend on the internet as a like COVID friend.
Support group. I'm one of the member in the support group.
Yeah. And if you like this video and if you want to see more of this like COVID infection like interviews, and please leave a comment. And if you have not subscribed to this channel yet, click subscribe and hit the bell. And whenever we have some new episode, it will go to your screen right away. All right.
Absolutely. I enjoyed Dr. Jin's program, every one of them. Thank you so much for the opportunity to discuss.
Thank you so much. I really, really appreciate you are now still have some coffee and you spend a lot of time with us and try to help all the audience as well. And I do appreciate you. And later, if I have some patient, they have some problem, then I can refer to this video. And this way, maybe we can give them more information and real information to help them.
Right, absolutely. All right. Thank you, everyone. Yeah, have a good week ahead of you. Bye-bye.
Bye.